Hi guys, my name is Dr. Mariela Padro. I am an adult psychiatrist. Yesterday I was part of a segment at Despierta America in Univision, and we spoke about postpartum depression. It motivated me to open this new account, I guess, and start posting videos and talking a little bit about different topics of mental health. Today, I just wanted to speak a little bit more about postpartum depression, just to explain a little bit further of about it. First off, I want to explain the difference between the baby blues and the postpartum depression. Baby blues are symptoms of sadness, anxiety, maybe being preoccupied about your new baby within the first 3 to 5 days after giving birth, and it should be gone by the 2 weeks after you give birth. This is usually attributed to the symptoms are usually attributed to the drastic change in hormones that we have after giving birth, since when we are pregnant. So since because when we are pregnant, our levels of hormones are on its highest point. When we give birth, then it drops basically almost immediately to a lower level, or where it was, before we got pregnant. So because of that change in hormones, then all these symptoms will come up, and that's why it goes. You could start having the symptoms in the first few days, and then it slowly starts going down and getting better because is the hormones are getting back on track or getting a little bit more stable. Now, the depressive symptoms, it's different because a depression should be at least a minimum of 2 week period where the symptoms that are present, that I'm going to explain now, the list of symptoms, they should be there mostly every day, minimum of 2 weeks. Now, for it to be postpartum depression, it could start within the first month, but it could also start up to a year after you give birth to your baby. So within the symptoms of depression, we have sadness, having crying spells, usually without a reason, crying very easily, um, feeling worthless, feeling that you're not a good mother, feeling hopeless, that you will never feel better. Your sleep, we know it's already affected by the baby waking up at night, but you have maybe a harder time falling asleep when the baby is asleep, or you have a harder time at night. Maybe you still wake up when the baby's still sleeping. So sleep becomes a problem, appetite becomes a problem. You stop enjoying, or you enjoy less the different activities that you used to enjoy before. Maybe you don't want to be around people. Maybe you don't want to leave your house. You don't want to change your PJs. You don't want to shower. You don't want to brush your teeth. You want to be more isolated. You start getting more irritated. Maybe you start arguing more with your partner. Um, so things start getting worse when it's not treated in intensity and frequency. So from maybe feeling it 2 to 3 times a week, maybe you start feeling it now every single day, and it starts getting worse. Um, there's different reasons for of course depression to really come in this particular case. Of course, postpartum, we have of course the hormones as always, but if you need to go back to work sooner, if you don't really have the help that you need when you have a baby, maybe your husband or partner can't stay with you at home, you're alone in a state, your family is not in the same place as you are, you don't have friends that can come over and help you, maybe you need to go back to work. Breastfeeding, I mean, breastfeeding is another thing that I would talk probably in another video. It's a very huge pressure that mothers have when they have babies. Maybe it's not going well, maybe it's painful, maybe the baby's not latching correctly. All those things start building up to a feeling of guilt, because you feel that you just had a baby, you should be very happy, you should be enjoying yourself, but here you are feeling crappy and sleepy and sad and crying, and you're not really enjoying the baby, you're not connecting to the baby, you're doing things as in almost a autopilot type of thing, because you just know you need to take care of this baby, but you don't really feel like you want to. So all these things is important for moms and dads out there to know that it is definitely possible to have. And don't feel bad because it's there. Don't feel bad because you're not being able to enjoy it. Just accept that you're going through something. Accept that the symptoms are there, and look for help. You can start talking to your partner. You could start there and see if with more support maybe it gets better. You take turns with the baby, for example. You at home, make sure you sleep a little bit more, make sure you rest, drink liquids, fluids. You gotta eat healthy. You gotta, if you can, go and do some exercise. Get yourself going. That's the type of things you can do at home. But if you see that you do all that and you're still not getting better, then go and look for help. You can see a therapist, you can see psychologist, and definitely you can see psychiatrists. If medication is necessary, then the psychiatrist will suggest. I'm going to also make another video that specifically talking about medication, because I think it is important to explain how medications can work, and whatnot, in any particular case. So I wanted to basically explain to you what are the different things that you can look for, while pregnant or after giving birth, and to not feel ashamed of having the symptoms. Look for help. I am here for you. I'm open to any questions that you may have. My office and my staff is also open to see you. I have therapists that are trained. We have a group support for mothers, and we're here to help you. Another way of treating also acupuncture or other ways is, my practice specializes in that. So just let us know. Our phone number is 305-456-1014. And you can also go into our website, which is mindandsoultherapy.org. Again, I'm here for you. And any questions that you have, please feel free to reach me. All right? Have a good day.